Thank you.
I'm going to give you a little of the context for what we did at Cone and why we did it. But this journey started a little over 2 years ago, and I really teamed with our Chief Learning Officer, Joan on the infrastructure and the process to work on our culture. 2 years ago, if you'd asked me about working on culture, I would have said, why? Well, the why kind of hit me in the face a couple of years ago, and we realized we had to make some major changes in our organization. So first, a little bit about who we are. We are 5 hospitals, soon to be 6, with another merger, located in central North Carolina, pretty much the only provider for our population area. So we take our jobs very seriously across our platform. A little bit about us, spread all over 2 or 3, 4 counties, soon to be 6 hospitals. You can see some of the data. Around 10,000 employees when we finalize a merger that we think will happen soon, FTC willing. About 1,300 medical staff members. 350 or so of those are now employed by us. So a large employment platform for physicians that happened really over the last 2 or 3 years. $1 billion, $1.3 billion now in terms of our financial annual performance. Going back in 2009, 2010, we recognized we needed to make some significant changes in our organization. So we went to our board of trustees and we rewrote our vision. Oops, and I just turned off the slides. And our vision really is expressed in national leadership. That was an audacious statement for us. I think we had been comfortable for a long time being leaders in our region, leaders in our state. But back at that point in time, we told our board that within 5 years, we wanted to be top decile performing in everything that we did. So I remember that board retreat where the board accepted that, and then I sobered up. And I said, how in 5 years do we go from being a pretty good organization to really being top decile performing? So at that time, our leadership team started to have some very difficult discussions about who we needed to be in order to lead this kind of an organization. In fact, were we the right leaders to lead an organization to top decile performance? We use this target diagram over here to describe our strategic plans, patient-centered, AAA in performance. Now, I got to say, we came out with AAA right before the IHI came out with a little different view on AAA, but our AAA in performance was around being best in quality, best in service, and lowest in cost. So we went out and started to put this out in front of our organization, at the same time realizing we had to reinvent the organization in order to achieve this vision. We recognized that the culture in the organization would either drive us to success or hold us back from succeeding. We started this work by doing a cultural assessment, different from an employee engagement assessment, but asking the employees of Cone Health what drove them to come to work every day. What did they feel about our organization? I wasn't too happy about what I heard back. What I heard was they were very proud of the organization. They felt valued by the organization. They felt valued for the work they did. They were very proud of our success as an organization. And oh, by the way, we took care of people. Did you hear that? That we take care of people was way in the background of those conversations. And yet I pride myself of being my background's clinical pharmacy, my wife's a nurse, we've always been in healthcare. That's not why I went into this field. So we challenged ourselves to rethink and put that patient in the center of that diagram. We believed that really culture was going to trump everything else that we did. So the case for change. I had a new chief operating officer from outside the organization. We'd gone through some tough transitions because the 2 internal candidates who were not selected as COO left the organization. So I had to reinvent my team. We had several other leadership changes that were in process. We had the cultural assessment, which we did not feel was congruent with what we felt really were the values that we professed. The organization had become very complex. We'd gone from a single hospital to 2 to 3 to 5 to 6, soon to be 6, to a physician enterprise, to a very complex organization. And we had this new vision around national leadership. So we realized that we really needed a breakthrough. So we started to develop an infrastructure. And we put together a coalition of leaders from across the organization. When I say leaders, I'm not saying leaders by title. We had secretarial staff. We had dietitians. We had social workers. We had nurses. We had physicians. And yeah, we had some of the members of the C-suite. And we had to spend 2 or 3 days with that group for them to even accept the mantle of leadership for this effort. A secretary is not going to trust you when you put her into the room or him into the room and say, we want you to be a leader for this new initiative. So we had to put together a whole different structure rather than a typical hierarchical structure that we'd use to drive results. And this diagram we used to go out to our organization to try to describe what we were trying to do. We had this drift, if we use that phrase, that had led us to a current reality or a current success at the time that we needed to change. And if we just kept doing what we're doing, we would continue to see probably improvements, but all the rest of the country is improving at the same time. So would we actually get breakthrough performance to go from 50th, 60th, 70th percentile performing to 90th percentile performing? Not if we kept doing what we were doing. So we knew that we had to really do something to kind of turn the organization upside down to make the breakthrough successes that we claimed that we're going to do. So the Executive Steering Committee recognized that it had to really change. We had this audacious goal by 2015 to have become a top decile performing organization. And we realized we didn't have the tools and the competencies in the leadership team that we needed to have in order to lead this change. Let me turn this over to my colleague, Joan Evans, to describe some of the process that we put in place and we've gone through. Joan?
Thank you, Tim. So as Tim said, we were an organization in transition. To use Jonathan Peck's language from just a few minutes ago, we were a high aspirational organization. We wanted to be very different than we had been previously. And so we took a hard look at the skills and competencies of our leaders, and as Tim said, had to do some self-reflection. Did we indeed have the skills and competencies we needed to lead transformation of this magnitude and to lead us to be one of the best healthcare organizations in the country? So we thought about who we were then and who we needed to be as a leadership team. Part of our past culture was that we rewarded effort. And what we realized, if we were going to truly be a top decile organization, we needed to reward results and focus much more on our ability as an organization to produce results. We spent a lot of time talking about stuff. And we would talk about stuff for months on end. And sometimes that led to action, and a lot of times it just led to more talk. And so one of the other things we realized is that we needed a leadership team that could talk about what mattered most in a new way, and that from that talk we were able to generate action to inform our new future. We were known for strong management skills, and yet if we were going to be a high aspirational organization, we needed leaders who were truly leaders and had vision that they could articulate to our entire workforce. Our past success was based on a strong financial focus. And as Tim said, the patient tended at times to be part of the background conversation. We recognized that we needed to maintain that strong financial focus and yet find ways to put patients truly at the center of everything that we did and everything that we talked about. Our employees told us they came to work every day to do a good day's work. But if we were going to be one of the best organizations in the country, they needed to come and show up every day with inspiration and passion, and our leaders did as well. All of us work in healthcare, and you know that we have silos, no matter how hard we work to break them down. And in some places, we had been successful breaking those down at Cone Health, and in other places, we recognized that silos were going to be a barrier to our future. And so we went to work very hard as a senior executive team on building shared commitment across our 8,600 employee members. And last and certainly not least, as Tim mentioned, we had to learn to step out of the drift. A drift that was very successful, and yet we knew wasn't going to achieve the kinds of results that we wanted within a very short period of time. So as Tim said, part of what we had to do was look in the mirror. And The Man in the Mirror became one of our theme songs for our cultural journey. And as my colleague Noel Burt says, the day that he woke up and recognized that the transformation needed to start with him was a rude awakening, a very inconvenient awakening. And yet for all of us as leaders, that's what we needed to focus on. So did we have the competencies we needed to lead this transformation? What behaviors were going to reward in our new culture, in our new organization? Those were things that we all struggled with and spent a lot of time talking about. And so how did we go about developing breakthrough leaders? We had a very robust and rigorous leadership development program already in place. And yet, if we kept developing leaders the way we already did, the way we always did, we would continue to develop leaders for our old way of being. And so we had to rethink our leadership competencies. We had to embed our new leadership competencies into our leadership curriculum, into performance management tools, into how we selected leaders coming into our organization. The 20 most senior members of our organization were immersed in a 9-month program called High Performing Leaders. And in this 9-month program, we taught the skills of transformation. We taught our leaders how to unhook from the past and to invent a future that we aspired to. A lot of this work was done through project teams, where we actually took what we were learning in the classroom and applying it to achieve breakthrough results back on the job. Results that we believed could only be created in this new way of being. Results that we would not have been able to achieve in our own culture. Every leader in our organization was required to attend a 3-day breakthrough workshop followed by a one-day session several months later. And again, for all our leaders, we taught these same technologies: how to unhook from our past, how to invent the future, how to enroll our employees. We talked about what did they need to transform about their leadership style and their leadership skills. And throughout all of this work we did with our leaders, we provided extensive executive coaching. Coaching in their new way of being, in our new way of being as an organization, coaching on how they could take what we were teaching them in the classroom and being able to apply it back on the job. So executive coaching became a fundamental aspect of our approach to developing breakthrough leaders. Another thing that we did is we leveraged the generative power of language, and we taught our leaders how to talk about a bold new vision in a very aspirational way. And we talked about the importance of language and what we say and how we say it. And I'm going to cue this video as just a short example of how important language can be. Try again later. It doesn't look like it's going to work. No luck, guys? Probably not. Okay. The YouTube link is on the handouts. So please, you can upload it now. It would be okay, right? Or later upload it. But the point is, and I'll just briefly highlight it. So the blind man is in the square, and the sign says, "I'm blind and I cannot see." And as you notice there, he gets very little response from people that come by. And a woman comes by and picks up his sign and rewrites the sign. And all of a sudden, everybody that comes by is making a donation. And she comes back by, and he says to her, what happened? What did you do, love? And she says, "I wrote the same, just with different words." And the words that she had written on his sign were, "It's a beautiful day, and I can't see it." The power of language to create different response in people. The power of language to align individuals for a possibility bigger than themselves. And so we used language and the power of language to create our future and enroll our employees in that future. Another key element of our work was to launch breakthrough projects. These projects were clearly aligned with our strategic plan and tactics on our strategic plan. And again, we're in the context of this bold new vision we had created for ourselves. And so the project work was around safety issues, it was around diversity and inclusion, it was around decreasing length of stay and readmissions, all things that we needed to do as an organization to continue to be successful. And we did them in the context of leveraging breakthrough technology, our new breakthrough principles, and again, in a culture which we don't believe we would have ever been able to achieve these results in this short of time. And Tim is going to talk about those in just a few minutes. Another key element was how we engaged our physicians. And Tim's going to talk about the results of that work around our physicians. But for the first time, they have really become partners with our organization in everything that we do. Almost a year ago, we took all of our leaders off-site for a day of learning, a day of celebration, and a day of fun. That day off-site for all our leaders was followed by days off-site for every single employee in our organization this past spring. And so through those efforts, we have aligned our employees and provided inspiration and passion. Another key element of our transformation has been our new values. And as Tim mentioned, an interdisciplinary team that included employees, executives, and physicians from across our enterprise were key in developing our new values. And we didn't want our values to be boring, as several of our leaders said. Tim wanted to write old values, and one of our leaders stood up in a meeting with him and said, "Tim, those are boring. We need different values." The fact that a leader in our organization could say that to him in a room full of other employees and leaders was indeed breakthrough for our organization. So our values are about caring for our patients, caring for each other, and caring for our communities. So all this is great, and we are well on our way, but what results have we been able to see? And Tim's going to wrap up our conversation today by sharing those results.
So some of you have got to be thinking how much we invested in doing this. I was doing the math when we had 300 leaders off-site for a day. But the power that I felt after that, I was the one that turned to the team that had put that together and said, "We've got to do that for all employees." And they said, "You're crazy. We can't take everybody off-site. You know, we got people to take care of." So as Joan said, we did it in 4 different sessions over 3 days and got 7,000 employees in the Coliseum to all hear the same vision, story, and to celebrate together. That has unleashed a tiger. That has created conversations in our organization where everybody understands our expectations and what's acceptable and what's not. So be careful, because now I get emails from the employees saying, "Tim, I saw something this week in my department that I don't think is consistent with what you want and what we all expect." I love that. So now we have this really massive people helping to hold us all accountable. But we just got through going live on Epic at 3 of our campuses. We did 2 others earlier in the summer. We've had many quotes from people there from Epic saying one of the best go-lives we've ever seen. It hasn't been seamless, but it's been darn good, given all that could go wrong with putting in a new IT platform. You can't see the details here, but you can see the arrow pointing to where we began our work on culture, and this is our patient satisfaction journey. And you can see, we think, a direct correlation to when the cultural work began. This is our Press Ganey employee partnership scores. 2 years ago at the 59th percentile. In July at the 87th percentile. The all-employee events were held in August. So I'm pretty confident if we took the surveys today, we would be in that top decile in terms of our employee partnership. Turnover. What is the cost of employee turnover? So again, this shows from the June of 11, when we had started this journey, through April, some of our turnover results. And of course, the industry, I think, as a whole, has experienced lower turnover because of the economy, but this actually is a snapshot from the middle of the economic downturn. This is a quote from Dennis Campbell. He's our Quality and Patient Safety Director. "I know that as a direct result of our focus on culture, the very fiber of who we are being every day, the patients we serve, are measurably safer. Achieving high quality and high reliability care is a journey that begins with culture, and Cone Health is well on that journey. I can feel it. Other results are all-in risk-adjusted complication index. We saw a 20% decrease in year-over-year performance. MRSA rates down 44%. And we weren't bad. You know, I don't want to give you the impression that we're bad in a bad place to start, but we were middle of the pack. Readmission rates for MIs, for heart failure and pneumonia, have shown remarkable decreases. A lot of that's been led by physicians. We are not where we want to be yet with physician engagement in this, but we've made a lot of progress. Still a ways to go. Speaking of our physicians, we had a 44% year-over-year increase in our physician satisfaction scores. Working with physician leaders, we have created a clinically integrated network. We were awarded in July a Medicare Shared Savings Project with 32,000 Medicare lives. So the development of that physician trust with us, but also physician to physician, has been huge. Most of the issues we heard from our physician leaders were trusting each other, not necessarily directed at the system, but at each other. We now have Cone Health Medical Group. It's 350 employed physicians. I used to say it had no structure whatsoever. We now have a structure in place that is physician-led. So this is an area where I think we're just starting to generate some of our gains, is in the physician cultural piece as well. Critical success factors from our points of view: it has to be led from the top of the organization. I had to change who I was. I looked in the mirror one day early on. I had followed a very successful CEO. And I think I spent the first few years of my job playing defense and judged my success every week or every month. Have I rocked the boat? Is the medical staff still generally happy? Is the board happy? Are other health systems around us happy or unhappy with us? Have I hurt anybody's feelings? Am I still doing a good job? Comparing myself to how the job was done 10 years ago. I had somewhat of an epiphany that if I was going to lead this organization to achieve these results, I had to play offense. I had to change my paradigm, how I showed up every day. So I have really enjoyed the last two years of really thinking about playing offense while I'm on the court, not playing defense. And I told 7,000 employees that same thing. And I think they appreciated my candor about that. We went to our board of trustees hoping for support with the cultural engagement. The board engaged. The board started to ask themselves if they were the right board to lead this organization going forward. So again, we just wanted support. We got complete engagement. We had to realign our work and to take off our plate things that were not aligned with that strategic plan. If everything is around the triple aim performance, then we ought to use that as our lens. If it doesn't help us advance quality, service, and cost, why are we doing it? So we've had to really let go of some things. Critical success factor, you have to get everybody at all levels. And that's hard to do because they don't trust you, they don't believe you at first. And you have to get out of their way. So that when you say we want you to take a leadership role, then you've got to let them lead. A big issue for us was unhooking from our past. I've been in the organization for 34 years. So there's a lot of baggage associated with me and with me to others. All of us had to let go of our past and not settle for our past performances if we're going to see this future, realize this future that we could see. So, 2 years into it, we have really made this our organization's future, but it's become the context for the work that we do. It's the context for a successful go-live on a new IT platform. It's the context for a very successful joint commission visit a month ago. It's the context by which we face the difficult choices and decisions we're going to have in our future, because they're not going to be easy choices. But we're trying to set that new context by really working on our culture. Thank you.